about the lungs. Okay, so when we're talking about air or respirations, if we have a compromise to what we call the box, so your box is from your trachea to your belly button. Okay, so this area right here, which includes the back. Okay, but we're talking about this box, right? So we're talking about the area right here. Okay, we call it the box. If I have a hole in the box somewhere, okay, our lungs work kind of like our circulation does in a pressure system, right? Our lungs are a negative pressure system. So if I mechanically try to force air into my lungs, I can only fill them about a third of the way, right? The pressure on the outside of the lung has to be less than the pressure inside the lung for it to expand, right? Your diaphragm contracts and so on and so forth. So if I introduce air outside the lung, your lungs and your chest, it's called your pleural space, but your pleural cavity, right? That's what it's called. If you take like 2 plastic bags and get them wet, they stick together, but they're not attached, right? They're hard to separate, but you can still attach them. If I introduce air into this space, so if I have a gunshot or a stab, air is now being sucked in, right? What happens is air starts accumulating outside of the lung, so now the lung can't expand anymore. So you start to get separation, and now the lung is slowly being less able to expand. It takes time. So when we get to respirations, it's roughly 15 to 17 minutes, and it's called a pneumothorax, where you have a collapsed lung, is what it's called. So when you get to this, it's like 17-ish minutes is before you start to see like a collapsed lung. For you guys, that's where this comes in. This is called a chest seal. Okay, so if you discover, when we're doing our sweeps like I showed you guys, if you discover that there's a hole in the box somewhere, you're going to put one of these on. So the shirt's going to come off, everything's going to come off, okay? And I'm going to open one of these so you guys can see it. I don't know, did Justin open one when we did it?
He did.
He had one already open, right?
Yeah,
I'm going to actually put one on the block so you can see it.
Cool.
So this is a chest seal, okay? So when you open them, some of them come in 2 packs. This is just a single one. So this is what it comes in.
We bought it. Yeah.
Yeah, you probably have, yeah, that's what this is, right here. This hyphen.
Oh, I see.
So this is a vented chest seal is what it's called. This is a vented chest seal as well. But this is just a 2-pack. The one I opened was a single, so it's a lot smaller. So these have vents in them. When I open this all the way, you have to be really careful because this stuff's super sticky. Okay, so this has little channels. You can see like the little cross, right? So what this does is when I put this on the wound, it's super sticky. Like this stuff, if it sticks to itself, you can't unstick it. It's impossible. It'll stick to anything. This was it's called hydrogel. It was actually designed right after World War II by a demolition team. They wanted to be able to stick all of their charges and all their explosives to any surface. So they came up with something called hydrogel. So they'd coat it and they'd be able to stick it to walls and whatever surface they came across. The medical field discovered it and went, hey, this is actually okay for the human body. Like, it's non-toxic, it doesn't hurt him, and it sticks to anything. We're going to use this for this application. And that's what so you can actually buy rolls of hydrogel and you can cut your own. You can make little strips, you can make big ones. Like, it's pretty cool. Yes?
How you can, when it's off, you can...
How to take it off?
Yeah, it will come off with a lot of... It just takes a lot to get it off. I mean, you can use like acetone or something, whatever, to get it off, but usually if you're putting it on, it needs to stay on for a while until they can actually get to a higher level of care. But this goes on, and you put it over the wound, so this clear part would go over the wound. So it has these vents in it. So what happens is when I breathe in, the vents suck to the skin, right? So it keeps air in, but when I exhale, if there's air outside the lung, it allows it to leave. Right? So it doesn't accumulate more pressure inside. It helps keep everything the same. Okay? So I'll take this off. And like I said, because some of them come folded, you have to be really careful when you undo these. So when I actually put these on, not fit, close enough. So when you put these on, you want to make sure, one, that it's undone all the way. Because if it's like this and I undo it and it sticks to itself, can't use it anymore. You got to get another one. because it's just so sticky. So you want to make sure that when you're peeling this off, that you peel it off. You see how sticky it is? Here, you want to feel it?
Not so bad. It's okay. It's not so bad.
Well, if you were to put it on and then step on it, yeah, it's gonna stick really bad. It's really sticky. And this one I've had for. I've had this one for a while. You want to replace them like every 6 months if you want to feel it. But if you put that on and shove it on someone, it's gonna stick. You want to put it on? You want to feel it? There. So when you put these on, you don't want to just peel this whole thing off, because if it's windy and it sticks to itself, you have a problem. So when I start to undo it, sometimes what I'll do is I'll just rotate it and I'll find where it is I'm gonna put it, and I actually will put it on first like this, and kind of like when you put a sticker on, you use like a credit card, kind of like that. So I find wherever it is that I want to do it. See how it folded like that? If I had this all the way open, it would have stuck to itself, right? So I find where I want to put it, right? So if I'm just putting it on, I guess I can put it over a hole, but if I want to put it on, right?
Is this something when like you pack the wound and then you put that over as well? Or
No,
that's
so
just
this
on the
is
chest?
in a spot on the chest where you can't pack.
I see.
So now I've got it on, like that, and then I will literally just do this. Put it on.
Like credit card swipe.
Yep. And I'm just getting the kind of the bubbles out of it or whatever, and like that's hard to get off. Okay. So, and see how it left this little vent, and it's got 4 holes. So when they inhale, it sucks in, so it keeps all the air in, so they're actually able to perfuse, is what it's called, to get oxygen to all of their muscles and tissues, blah, blah, blah. When they exhale, that pocket will lift, and it'll actually let air leave the cavity. So, you brought up a question about packing. So, anything in here, we can't pack this. There's nothing to pack. We need bone in order to pack something, right? If I were to take like if I took like one of these little things right here, like I'll just say this, whatever, and I said, okay, like put pressure on this to close it with it like this, I can't, right? With one finger, like I can't do it. But if I said, okay, now do it, now I can, right? Because I have a hard object that I'm actually able to push against, and that's why we're able to pack these areas,
I see.
because we're packing against bone. This is all just kind of a mess of organs, and it's a big cavity. You'd run out of gauze and clothing before you even filled the whole thing. So, so what we're doing is, this is for air. It does work with fluid. However, we get into the other part of respirations. I guess I could have wrote respirations on there. The other part of respirations is, earlier I brought up